Good afternoon, and thank you for joining us today. I would like to go ahead and start on the behalf of Centers for Medicare and Medicaid Services, CMS, Division of Tribal Affairs. I would like to welcome everyone to an All Tribes webinar. My name is Sherry Gay, and I work for Kaufman and Associates. I'll be your moderator today. Today's webinar is titled CMS Framework for Advancing Healthcare in Rural, Tribal, and Geographical Isolated Communities. Please note this webinar series is supported by a contract awarded by the Centers of Medicare and Medicaid Services. And at this time, I will turn it over to Beverly Lofton.
Thank you so much, Sharon. Hi, I'm Beverly Lofton. I'm a Senior Policy Advisor in the Division of Tribal Affairs at CMS. So welcome to today's webinar. This webinar is in collaboration with the CMS Division of Tribal Affairs and the CMS Office of Minority Health. During this webinar, our presenters will provide an overview and updates regarding the Office of Minorities Health's CMS Framework for Advancing Healthcare in Rural, Tribal, and Geographically Isolated Communities, rural health resources, including coverage to care, tribal roadmap to better care, community engagement efforts, and forthcoming initiatives. Any of the materials that are related to this presentation can be downloaded from the Spotlight page of the CMS American Indian and Alaska Native Outreach and Education website, and that can be found at go.cms.gov/AIAN. The website link will be added to the chat. I am pleased to be joined on this webinar by Iris Allen-Jean and Darcy Graves from the CMS Office of Minority Health, and supporting staff, Jordan Romero from Ketchum. At this point, I will turn it over to Iris to begin the presentation. Iris.
Hi, everyone. My name is Iris Allen-Jean, and I'm an African-American woman. Today, I have on a Black sweater and a Black sparkly headband. I am with the Centers for Medicare and Medicaid Services, the Office of Minority Health, or CMS OMH. Thank you for joining us today for this roundtable to discuss advancing healthcare in tribal communities. We are excited to partner with our colleagues in the Division of Tribal Affairs today. We know that you all have existing relationship with others in CMS, so we are grateful for your time and participation today. This roundtable is not meant to replace or duplicate any conversations that you may already be having, but rather to ensure our office and DTA continue to build a strong relationship with and in service to tribal populations. As CMS OMH continues to expand our efforts in this space, we wanted to take the opportunity to introduce ourselves today and hear from those of you on the call. CMS OMH works with local, tribal, and federal partners to eliminate health disparities while improving the health of all people through its health equity initiatives. As you are all aware, health inequities in tribal communities are complex and multifaceted. These communities, your communities, encounter health challenges rooted in historical trauma, socioeconomic and cultural barriers, as well as other social determinants of health that lead to disproportionately higher rates of chronic conditions like diabetes, cardiovascular diseases, and obesity. Our shared commitment to tribal communities extends beyond this roundtable. It embodies the reciprocal relationship and open dialogue that CMS OMH hopes to continue and foster with each of you to drive meaningful change. We are grateful you are here and look forward to learning from you and the organizations you represent and the communities you serve. Today, we will begin with a brief overview of CMS's recent engagement with tribal communities, current CMS rural, tribal, and geographically isolated health initiatives, as well as other programs and initiatives we have in place that may be of interest to your organization. After that, We would like to open the floor up to an interactive discussion to get your input on ways you would like to see us advance this work in tribal communities. CMS is the largest provider of health insurance in the United States. CMS is responsible for ensuring that more than 160 million individuals who are supported by CMS programs get the care and health coverage they need to live a healthy life. Our Office of Minority Health is one of 8 minority health offices within the larger Department of Health and Human Services. CMS OMH advises the entire agency on the needs of medically underserved populations. Please know that we work closely with our colleagues in the Division of Tribal Affairs, as well as the Tribal Technical Advisory Group. And we are committed to ensuring that the health and well-being of rural, tribal, and geographically isolated communities are among our top priorities. During this roundtable, we will collectively refer to rural, tribal, and geographically isolated communities. Given today's audience, we may refer to just rural or tribal communities as appropriate throughout the session. I will now turn it over to Darcy Graves to highlight some of CMS OMH's current health efforts in tribal communities.
Thank you, Iris, and good afternoon, everyone. My name is Darcy Graves, and I am also with the CMS Office of Minority Health, where I serve as a technical advisor. I am a white woman with brown hair, glasses, and a mauve sweater. And I just want to say thank you so much for joining us today. As you know, within tribal communities, CMS, along with its partners, is driven to reach its enrollees, eligible individuals, their families, and caregivers. And we are excited to share resources specific to tribal health with you today and how we have been engaging with tribal communities, ensuring culturally specific approaches and inclusive initiatives that address the unique healthcare needs of these communities to date. Similar to a regular all tribes call and webinar, this conversation we're having with you today seeks to add to the broader conversation by sharing some of what CMS and CMS OMH are actively working on. These gatherings aim to exchange knowledge, address healthcare concerns, and co-create solutions that prioritize the diverse needs of tribal nations. Furthermore, the Long-Term Services and Supports Technical Assistance Center offers valuable resources to enhance long-term care services for American Indian and Alaska Native populations. Additionally, the development of Native language public service announcements ensure that crucial healthcare information is accessible in multiple languages to diverse American Indian and Alaska Native populations. Lastly, on this slide, we show some of the behavioral health resources that are available and tailored to tribal communities. For example, the Tribal Medication Assisted Treatment Program provides culturally competent care to American Indian and Alaska Native individuals who may be suffering from substance use disorders. As I'm sure you are aware, tribal communities, along with so many, continue to grapple with persistent healthcare professional shortages, attributed to factors such as geographic isolation and resource limitations. These shortages impact various healthcare specialties and compromise healthcare quality and accessibility across diverse geographic communities. To counter some of these challenges, CMS recently allocated 200 Medicare-funded physician residency slots out of a total of 1,000, with a focus on enhancing the healthcare workforce in underserved communities, particularly emphasizing primary care and mental health specialties. This program will effectively distribute the initial 200 positions to 100 teaching hospitals across the United States and U.S. territories, with priority considerations given to hospitals in health professional shortage areas. We now want to spend a moment discussing the current rural, tribal, and geographically isolated health programs and initiatives at CMS, or some of the additional programs at CMS. As you may recall, we held a similar all tribes call when developing the CMS Framework for advancing healthcare in rural, tribal, and geographically isolated communities, the framework that Beverly mentioned earlier, that was released in November of 2022. The input we received was critical to informing our overall efforts to advance health equity expand access to quality, affordable health coverage, and improve health outcomes for all Americans. In addition, over the next 5 years, we want to continue to work closely with you and our colleagues in the Division of Tribal Affairs to put this framework into action. In this way, we have a better chance of achieving high quality, affordable care for everyone in and across geographically diverse communities. Listed on this slide are the 6 priorities of the CMS Framework for advancing healthcare in rural, tribal, and geographically isolated communities. To be conscious of time and make sure that we have time for the discussion at the end, we're only going to highlight the first priority area here now, applying a community-informed geographic lens to CMS programs and policies. Examples of this include this very call, our regional rural road trips, our site visits, and our work with the CMS Tribal Technical Advisory Group. The other priority areas include increasing collection and use of standardized data, strengthening and supporting healthcare professionals in your communities, optimizing medical and communication technology, expanding access to comprehensive healthcare coverage, benefits, and services, and finally, driving innovation and value-based care. And when we talk about innovation here, we're not just strictly talking about innovation in the sense of the CMS Innovation Center, but rather innovation across the board, thinking about how do we reach communities who are maybe geographically isolated or don't necessarily have all the resources, all of the great strengths. Rural communities and also many others have figured out how to do more with less for so long. Not that they should have to, but they have. And so we want to continue to drive innovation and amplify these successes. In 2016, the CMS Rural Health Council was established. And for the last 3 years, I have had the privilege of co-chairing this council, which includes representatives from across the agency dedicated to this work. And the council addresses 3 strategic aspects, including improving access to care for Americans living in rural, tribal, and geographically isolated settings, supporting the unique economics of providing healthcare in these areas, and ensuring that healthcare innovation agenda fits rural, tribal, and geographically isolated healthcare markets. In recent years, we have added 2 subcommittees to the Rural Health Council, one focused on tribal nations and the other on the Pacific and Caribbean territories. This council and its subcommittees help to ensure that CMS is meeting the needs of those working and living directly within these communities. Additionally, CMS has continued to engage rural, tribal, and geographically isolated communities through such venues as our rural open door forums. The last forum took place last fall, where we discussed issues like the fiscal year 2024 hospice final rule, which will have an influence over the future of rural healthcare. CMS staff also include rural health coordinators and, of course, Native American contacts who provide technical policy and operational assistance on rural health and tribal issues. On this slide, we have highlighted a couple of the current data and publications from CMS to help address health disparities in rural, tribal, and geographically isolated communities. The Mapping Medicare Disparities tool, also referred to as the MMD tool, pictured here as an interactive map designed by CMS OMH to identify areas of disparities among Medicare enrollees, including American Indian and Alaska Natives. This tool is a great starting point to understand and learn more about geographic, racial, and ethnic differences in health outcomes. Additionally, last November, we released the Advancing Rural Health Equity in Rural, Tribal, and Geographically Isolated Communities FY 2023 Year in Review report, the cover of which is pictured here, which outlines the various ways that CMS has worked over the past year to meet the needs of these populations. And we worked, again, as always, in concert with the Division of Tribal Affairs to make sure that all of their work is well represented And all of the efforts that CMS is doing to advance health equity across the board is included in this report. So now I'm going to pass the virtual microphone back over to Iris so that she can discuss some of our other CMS OMH initiatives.
CMS OMH, under its Rural Maternal Health Initiative, has worked to gather feedback regarding opportunities to improve rural maternal health care access, quality, and outcomes in rural and tribal communities. On this slide, you will see one of the key outputs of this initiative, our Advancing Rural Maternal Health Equity Report. The purpose of this report is to raise awareness of these efforts and identify opportunities where we can collaborate to advance maternal health in your communities. Additional maternal health resources include the Women's Preventative Service Flyer, CMS's health plans committed to using birthing-friendly designation list, and the CMS Maternity Care Action Plan. Next slide. Over the next few slides, we would like to tell you more about 3 other programs and initiatives that are not specific to any one community, but could be beneficial to your organization. The first is our Coverage to Care Initiative, or C2C. Regardless of the consumer or insurance type, everyone can use C2C resources. C2C has many materials available to assist partners and consumers in their healthcare journey, all of which were designed with individual and community feedback in mind to ensure that they reflect the needs of the community CMS services. The C2C resource we would like to highlight is the Tribal Roadmap to Better Care, and that is pictured here. This version of the roadmap is tailored to American Indians and Alaska Natives. It helps to explain what health coverage is, how to connect to the coverage that is best for them, and special provisions that American Indian and Alaska Natives have when it comes to Medicare, Medicaid, and the Children's Health Insurance Program, also known as CHIP. In order to sustain the cultural richness and strengthen the well-being of present and future tribal communities, we are looking to update the tribal roadmap to better resonate with tribal audiences. We will go over the proposed changes during our discussion period. We want to highlight the opportunity that is the Minority Research Grant Program, or MRGP, administered by CMS OMH. MRGP supports health equity research at minority servicing institutions, or MSIs, including tribal colleges and universities that explore the healthcare needs of racial and ethnic minorities, people with disabilities, LGBTQI+ communities, and people in rural, tribal, and geographically isolated communities. MRGP also supports CMS's efforts to advance health equity by increasing understanding and awareness of health disparities, developing and disseminating solutions, and implementing sustainable actions within CMS programs. For the past 2 decades, CMS has awarded 3 grants annually of up to $333,000 each to eligible institutions. Eligible minority servicing institutions include historically Black colleges and universities, Hispanic serving institutions, tribal colleges and universities, Asian American and Native American Pacific Islander serving institutions, Native American serving non-tribal institutions, Alaska Native and Native Hawaiian serving institutions, and predominantly Black colleges. Medicaid is essential to the health needs of many individuals in tribal communities. As of 2020, over 1.8 million American Indians and Alaska Natives were enrolled in Medicaid. Medicaid renewals are crucial to ensuring continued access to essential healthcare services for eligible individuals. American Indians and Alaska Natives can enroll in Medicaid, Medicare, and CHIP at any time of year and are not restricted to the usual open enrollment periods. However, it is crucial to consult with the different agencies and tribal health offices for precise details and eligibility criteria related to enrollment and coverage options. Before we start the discussion portion of this call, this slide shares some of the rural health resources that are available on our website, including Rural Health Clinic Center and FQHC Center. During the discussion, we will ask if and how your organization has utilized these resources. We look forward to learning more from you. We will now move into the discussion portion, which will be moderated by Jordan Romero from Ketchum. Ketchum is CMS OMH's communications contractor. Jordan, I'll turn it over to you.
Thank you, Iris. Hiyoho, na Jordan Romero Mayahomo, Tuatutanaya Wamo. Hello, my name is Jordan Romero, and I'm from Taos Pueblo in Taos, New Mexico. I am a Native American woman with brown hair, and I am wearing glasses, a black shirt, and a red necklace. We are very excited to be with you all here today to have these conversations and learn more about the nuances of healthcare needs in the tribal communities and how we can support your needs within and across CMS OMH initiatives. I will ask that when providing your first comment, you also note your name and your organization for the group's awareness. While we want this to be a free-flowing conversation in which we are able to build upon each other's comments, we want to make sure that we don't speak over each other. So please use the Zoom hand raise feature, and I will call on you to unmute your line and share with us your thoughts. So for this slide, we wanted to really start at the beginning. Iris touched on terminology earlier in the presentation portion of the call, and as it stands right now, we use rural, tribal, and geographically isolated communities when we refer to rural, tribal, and geographically isolated communities, and we realize that that's a mouthful. As such, we wanted to hear your calls and hear your thoughts and ideas about utilizing any of these names listed on the slide as options that could potentially encompass all rural, tribal, Pacific, Caribbean, and geographically isolated communities. But at the same time, we do understand that there are nuances across each of your communities, so we're trying to be mindful of those. At this time, as you can probably see on your screen, there is a poll option. So we would like to ask you to select the option that best resonates with you and your community. At this time, you can go ahead and start doing that. When you're answering that question, just kind of think, do you see your community and their unique needs? If we say rural and geographic health, how do you prefer to rephrase it? And if there's another option, I encourage you to put that in the chat as well. So go ahead and start responding to the results. We'll give you a little bit of time to do that. And just a few more seconds, so get your answers in there. And don't worry, if you miss it, then you can put it in the chat. But we'll go ahead and close the poll now. And we'll share with you those results. All right, well, it looks like we kind of have an overwhelming rural and tribal communities plus response. Did anybody who voted for that want to come off of unmute themselves or raise their hands, unmute themselves, and discuss why they picked that option? And if not, that's okay. We definitely appreciate you guys all voting in that poll. It really helps us when we're looking to advance, our terminology. So earlier in the presentation, we did briefly touch on the 5 priority areas listed in the CMS framework for advancing health in rural, tribal, and geographically isolated communities with Darcy. But we wanted to bring this back around and kind of dig in a little deeper. Our question to you today is, which priority is most important to you, your organization, and your community? I do realize that we do have a variety of attendees today from different organizations, so I'm certain that certain priorities will hold more weight than others, but we would like to hear from you and see where those priorities resonate for you guys. And again, just raise your hand if you wanted to speak. Melissa Gower, go ahead and unmute yourself and you can go ahead and tell us your thoughts.
Hi, this is Melissa Gower with the Chickasaw Nation in Oklahoma. I would say priority 5, and the reason is that because it is a broad priority. Some of the other priorities are more specific on a certain issue, and number 5 seems to, be much broader. We definitely need expanded access to comprehensive healthcare coverage, benefits, and services. And that's why I picked number 5. Thank you.
Thank you so much, Melissa. I really appreciate your feedback. Is there anybody else who would like to share which priority resonates with their organization or communities? All right, be it none, go ahead and again, put that in the chat as we move on in case something does come up and you want to include that. Okay, so we're going to go ahead and shift our focus a little bit to see to data and to see how and if you've been using the data. And if you haven't, that's okay too. So just by a show of hands, I won't call on you, I promise. Go ahead and just raise your hand if you are using the data. That would include the MMMD tool, the Advancing Health Equity in Rural, Tribal, and Geographically Isolated Communities reports, those kind of things. All right, a couple of hands raised. It's always encouraging. All right. And again, no pressure. For those of you who did raise your hand, if you wanted to share any examples of how you use that data, that would be helpful. But again, if that's okay, if you don't want to. Karina Scott, we'll go ahead and unmute you and go ahead and talk when you're ready.
Yeah, I would just say I'm new to working with tribal communities. I'm a new tribal liaison for an NCO in Nebraska. And so I definitely use that data in those publications just to familiarize myself, even before I ever even started working or going out into the community, just to learn and have as much knowledge as possible.
Great, thank you, Karina. Is there anybody else? All right, well, for those of you who didn't raise your hand, I am curious, what would make the data and publications more useful to you so you would use them? Is there something that you would like to see that would make you use them? No? Okay, that's fine. Again, if you think of anything, go ahead and Carrie, go ahead and we'll give you speaking permission and go ahead and unmute when you're ready.
I would say I'm in Hawaii and our data tends to get lumped into maybe Hawaii or Pacific Islander, but in fact, we have a multitude of ethnicities here. And if it was broken down to more appropriate represent each group, it'd be more useful.
Yeah, definitely. Thank you so much, Carrie. Really appreciate that. Anybody else who would like to share their thoughts?
We do have a comment. Due to high staff turnover, if we could get a bulletin quarterly so new staff have access.
Good point. We will definitely make a note of that. Thank you for sharing. All right, so we'll go ahead and move on to the next question that I have is, what gaps or essential information is missing or crucial for making informed decisions in tribal communities? And these are data gaps. So is there anything that you guys can think of when you consider to be what are the most pressing needs, data needs that are there when it comes to tribal healthcare? Are there aspects of tribal communities that are underrepresented or inadequately covered in existing data sets? Well, thank you so much. We'll go ahead and go to the next slide. All right, so as we mentioned earlier, we are looking to update the Tribal Roadmap to Better Care resource. As it stands right now, the only difference between the Tribal Roadmap to Better Care versus the general roadmap is the insert that is pictured here on this slide. And then the title. So it literally says, Better Roadmap to Better Care Tribal version. And while there is a lot of good information here, we do want to expand on this insert with proposed changes throughout the tribal roadmap to help it address the unique needs and challenges of tribal communities, with the goal to be that to ensure that our tribal individuals from tribal communities, upon reviewing this resource, not only identify with it, but also find pertinent information tailored to their specific needs. We'll get into those specifics of the proposed changes on the next slides. All right, so the first of these changes include an introductory paragraph written here to go on page 1. That introductory paragraph will read, "This version of the roadmap has been updated to help members of the American Indian Alaska Native community connect with their healthcare, including benefits provided through the Indian Health Service, IHS, Medicare, Medicaid, marketplaces, or private insurance, Unlike Medicare, Medicaid, the IHS is not an insurance program or an established benefits package. The IHS cannot guarantee funds are available each year, and as a result, sometimes needs to prioritize patients of greatest needs. The preservation of legacy, heritage, and traditions is vital. This roadmap is designed to help sustain cultural richness and strengthen the well-being of present and future American Indian and Alaska Natives for generations. To learn more about enrollment in Marketplace, Medicare, and Medicaid, see pages 4 and 5 or visit www.ihs.gov/forpatients//. So I kind of just wanted to get your thoughts. You can put it in the chat, you can come off mute or raise your hand and come off mute on what you think of this. It's kind of, again, just to like identify that this is a roadmap for tribal individuals, and that's where our focus is on. You can do, I don't think you can actually do reactions on this one, but yeah, you can raise your hand, you can put it in the chat, do you like it?
We do have a comment from Melissa Gower. Just wondering if CMS TTAG has been involved in reviewing this report. It seems that you should start with the basics, why coverage is needed, helpful for ANs when they have access to IHS and tribal programs, how they should pursue other coverage options, Medicaid and Medicare, CHIP, VA, before getting ACA marketplace coverage. The report seemed to only provide a short summary of the tribal protections in the marketplace, which most likely hard for anyone to understand. It is then followed by generic instructions for using healthcare insurance. Thank you, Melissa.
Yes, thank you, Melissa. All right, be it none, we'll go ahead and move on to the next part. The next part is the title change. Right now, it currently says special protection, and this is for the insert. It says special protections for American Indians and Alaska Natives. Some of the proposed changes include changing the title to either ensuring the federal trust responsibility, unique protections for American Indians and Alaska Natives, or strength and wellness, empowering American Indians and Alaska Native health. So we're kind of wondering, do you like the old title? Do you like any of the new ones? Again, you can put it in the chat. You can raise your hand, whatever you prefer. Thank you, Melissa. And Lauren, appreciate it. All right, we'll go ahead and move on to the next slide. All right, so we also want to add accessing tribal resources under the helpful links page and the health insurance enrollment section with the following links that are listed here. Some of them include the CMS American Indian Alaska Native Information, Division of Tribal Affairs, Native American Contacts, and then of course just the goonlinehealthcare.gov/tribal. Are there any links here that you can think of that we are missing that we would like to see in this resource? Link ihs.gov. Good idea. Anything else? All right. The other additional proposed change is to include the following glossary terms. Right now, as it stands, they're pretty, basic, but these ones would actually resonate with more American Indian tribal communities and individuals. So they're listed here. And we would also propose a link to the full tribal glossary in this section as well. So again, do you like all of those ones that we have listed? Do you think we don't need any of them? Anything like that, any kind of feedback would be helpful. Thank you, Melissa. Should be the contract health services or purchase referred care. Overall, just what are your impressions of the proposed changes to the tribal roadmap to better care? Do you like them? Do you think we should just leave it the way it should be? Any thoughts? All right, be it none, we'll go ahead and keep on moving because there definitely are more discussion questions. So next slide, please. Okay, so for this last part of the discussion, we really want to look into our ongoing CMS OMH initiatives and then start looking into the future. So if you can just put into the chat if you have engaged with coverage to care resources, and again, if you haven't, that's okay, but I just kind of want to get a general overview on if you've engaged with them or not. You can say yes, no, whatever you prefer. Thank you for responding, Brenna. Appreciate that. All right, couple of no's, that's okay. All right, if I can just ask you guys, either Brenna or Marley, what's the reason you guys didn't use them? Is it because you hadn't heard of them before? Are they just not relevant, or any reason why you wouldn't use them? Marley, haven't heard of them. Okay. That's helpful. So we really do appreciate that. And I do just want to keep this discussion moving. We can reach out to Melissa's statement statement that she put in the chat a little bit later if we have time. But just trying to really keep this discussion moving. I know we have worked with with the Division of Tribal Affairs in reviewing, anything that we do with CMS OMH.
I'll jump in really quick too, just to answer Melissa's question if it's helpful. We do plan to have OMH at our next in-person TTAG meeting. So the information here will be brought to the TTAG as well, so that TTAG has a chance to review and discuss.
Thank you, Beverly. All right, so kind of moving away from the C2C, how effective are current CMS initiatives in addressing the unique healthcare challenges facing your tribal communities? These programs would include the Minority Research Grant Program or things of that nature. Are there any ways that you can think of on how we can bolster our initiatives to be more inclusive? Anything you can think of? And thank you, Melissa. We'll definitely keep that in mind and make a note of that. Okay, we'll be it now. We'll go ahead and move on to the next slide. So looking ahead, we are having the 2024 Health Equity Conference coming up this May. In 2023, at the inaugural Health Equity Conference, we were fortunate to have a couple of sessions related to tribal health. For the new one, we would like to increase that number. So we want to encourage you all to submit proposals for breakout sessions and poster presentations related to tribal health by February 9th, 2024. Additionally, we are having a call for proposals webinar tomorrow on January 18th to share more about our proposal guidelines and how you can submit your work. If you are interested in attending that, please go to cmshealthequityconference.com/proposals to register for that webinar. That being said, what aspects of health equity that apply to tribal communities would you like to see featured at the conference? Is there anything that you would like to see discussed? Anything that's very important to the health needs of tribal individuals? You can raise your hand, or you can put it in the chat, whichever you prefer. Okay, thank you, Melissa. Appreciate that comment. Any other comments before we move on to the next question? Just want to make sure we're giving everybody enough time to answer. Okay, well, moving forward, how can we anticipate and address potential challenges to further enhance tribal healthcare through CMS initiatives? I do realize, making sure that CMS TTAG policy and legislative priorities, input from them are, really high up on that list. So thank you for sharing that. That's definitely helpful. But are there anything else that we can do to anticipate and address potential challenges? And then on the flip side, is there any way that we can amplify opportunities or highlight success stories for those living and providing care in your communities? I know personally when I worked with my tribe, it was always helpful to see what was going on in other areas, what other tribes were doing. That way you can kind of tweak it a little bit, make it more your own and make it work for your own community. So is there anything that you would like to share about that? Or how we could potentially do that? Again, feel free to raise your hand, put it in the chat. Lauren, I see that you put, what about a newsletter similar to IHS? Okay, and Melissa, you might partner with NIHB and SGCE whom both have have a lot of success stories already done. That's great. Thank you.
And thanks, Melissa. I was just going to add that NIHB does have a story bank. So you can always check with NIHB's website, because they have a story bank of success stories from tribal communities on when they've had success with their healthcare program. So this is a great opportunity if you want to check in on some of those stories that they have collected.
All right, any other final thoughts? All right, well, if that's all, again, you can put our thoughts, concerns, anything else into the chat, and we'll be sure to take note of those. But I want to thank you all for your engagement and invaluable insights into our discussion. I will go ahead and now turn it back over to Iris.
And thank you, Jordan. And also thank you for all of the feedback that we did receive. It is helpful to know when materials and resources we have available. It's helpful to know when you aren't familiar with them, because that lets us know we need to focus on getting the word out that there is a resource that can be utilized. So we appreciate this, and we look forward to going to the next TTAG and talking more about the tribal roadmap to better care, as well as some additional questions that we might have to pose for the TTAG. So we thank you for all of the feedback today and for taking your time. On this slide, we have listed the different ways you can connect with CMS OMH. I'd like to draw your attention to the CMS Rural Health email address and the CMS Rural Health website. These are essential resources. Many of the things that we mentioned on today's call can be found linked there on the website. Essential resources for staying informed about rural, tribal, and geographically isolated community efforts can also be found there. As we close, we want to reaffirm CMS's commitment to addressing barriers to care and improving healthcare for rural, tribal, and geographically isolated communities. As you can see, CMS is consistently working, engaging, and adjusting to ensure we're creating policies, initiatives, and programs that meet the needs of geographically diverse communities. As CMS OMH continues to expand our efforts in this space, we look forward to continuing to pave the path forward with rural, tribal, and geographically isolated communities who are just as committed to reducing disparities as we are. Together, we can drive the next decade of rural health equity, so please engage with us. Again, thank you for your time and feedback. These slides will be distributed to all attendees soon for your reference. Have a great rest of your day. I'm going to turn it back over to the Division of Tribal Affairs for their closing remarks, and that would be Beverly.
Hi, and I'll also ask that all presenters come on just in case there are any questions. So we will all just highlight all presenters, please. Thank you, Iris and Darcy and Jordan, for that wonderful presentation. So now we'll ask, are there any questions that you would like to have us address? I'll just draw your attention to that one last comment that came in from Jacob that mentioned challenges to access to broadband and internet. That just remains a prevalent issue among rural and tribal communities, just so you have that in your queue of comments. So I would like to thank all the participants for being a part of this webinar. And I also want to remind you again that a copy of the webinar will be found on the spotlight page of the American Indian and Alaska Native Outreach and Education website. And that's again is at go.cms.gov/AIAN under all tribes calls. And as always, if you'd like to submit any inquiries to the CMS Division of Tribal Affairs mailbox, that mailbox can be found at tribalaffairs@cms.hhs.gov. So thank you again and have a great afternoon.